I want to do the cat skeletal muscles. So let's get started with the very first one here. So right here we have the masseter muscle. This is a chewing muscle. Next one we have the digastric muscle right here and right here on the other side. This muscle right here in between the digastric muscles would be your mylohyoid. So mylohyoid is right here. So digastric, mylohyoid. Next, we have the sternal-mastoid here and here. So here's your sternal-mastoid here and here. Sternal-mastoid here and here. Next, we have the sternal-hyoid right here. Sternal-hyoid is right here. Right there. Sternal-mastoid. There. And there. Sternal-hyoid. And then underneath the sternal-hyoid, you have your sternothyroid right here. Next, we have the cricothyroid right here. Next, we have the thyrohyoid right here. I want to show you the same thing on this cat so we can see the same thing here. So right here we have the masseter muscle, and then we have the digastric muscle right here and right here, and then we have the mylohyoid right here between the digastric muscles, and then next we have the sternal-mastoid right here, and then next we have the sternal-hyoid right here, and then the sternothyroid right here. And then over here, I want to show you this cat here. We can see the same thing here. We have the masseter. Let me make it clear. So we have the masseter muscle right here. We have the digastric muscle right here and right here. We have the mylohyoid right here. And then we have the sternal-mastoid right here. Here's your sternal-mastoid muscle right there. And then same thing right here, sternal-mastoid. And then I did a butcher job and destroyed the sternal-hyoid. Right here you can see the sternothyroid really good. The sternothyroid is shown really good right there. So digastric muscles here and here, and then you have your mylohyoid. I want to next continue with the chest muscles. So let me show you. Sorry about that. So let me show you the. Just don't want to lay there, does it? So right here, we can see the pectoral antebrachialis right here. Pectoralis major, pectoralis major, minor, and then this one right here would be the xiphi humerales. So we have the pectoralis major, minor, and then cat specific xiphyohumerales. This is the pectorantebrachialis, pectoralis major, minor, and xiphyohumerales. Okay. Let me show you the same thing over here. So, right here, we see the pectorantebrachialis right here. Pectoralis major, minor, and then xiphyohumerales. This is the pectorantebrachialis, pectoralis major, minor, xiphyohumerales. Okay, so that's got that taken care of. Let's move on to the trunk muscles. I want to show you these trunk muscles now. So let me flip this cat over here and turn it around. And I'm going to show you the trapezius muscles first. So right here, we can see the clavotrapezius right here. Hopefully you can see the clavotrapezius right here. Next, we have the acromial trapezius. And then spinal trapezius is right here. So, first we have the clavotrapezius. Next we have the acromial trapezius. And next we have the spinal trapezius. I want to show you on this cat. So, we can see these trapezius muscles again. Clavotrapezius, acromotrapezius right here, and spinal trapezius right here. This big muscle right here is your latissimus dorsi. This is latissimus dorsi, and this structure right here is your lumbodorsal fascia. Latissimus dorsi, spinal trapezius right here, and then your acromial trapezius, and then the clavotrapezius. So clavotrapezius, acromial trapezius, and spinal trapezius. I want to show you the deltoid muscles. There's two deltoid muscles. We have the spinal deltoid right here, and then the acromial deltoid is this one right here. This strap-looking muscle here is the levator scapulae ventralis. So, acromial deltoid, spinal deltoid, and levator scapulae ventralis. Okay, want to next talk about the muscles underneath the acromial trapezius and spinal trapezius. So we can see on this other side here, I have cut the acromial trapezius and reflected it back. I've cut a little bit of the clavotrapezius, and I've cut through the spinal trapezius. So right here you can see the supraspinatus is right here. Supraspinatus is right here. Hopefully you can see that. And then right here we have the infraspinatus. So let me fix that a little bit. So here's your infraspinatus right here. So supraspinatus and infraspinatus. This muscle right here, which I don't think you can see that good well, but right here you can see the teres major right there. Okay, so let me show you this on this other cat here. Well, let's do this one. This one's probably better. Let's do this one. Well, this one looks better. Okay, so you can pretty much see the same thing here. You can see the acromial trapezius is being cut, and you can see the supraspinatus right here. Move some fascia. So supraspinatus, and then you can see right here the infraspinatus. What is this one here? That's your teres major right there. Okay. And I think we're good all except for the subscapularis. So the subscapularis is right here. So here's your subscapularis right there. So I'll just show you those muscles again. Supraspinatus, underneath your acromial trapezius, underneath the acromial trapezius. And then we can see the infraspinatus right here, teres major. And then right in here, if you just bear with me, this is the subscapularis right there. Okay, I want to next show you on this side the subscapularis. So let me move this around here. Now, right in here, you can see the subscapularis right there. There's your subscapularis. Okay, I want to next show you the abdominal muscles. So, the abdominal muscles are a little bit tricky. And that's because of the way the skin is. You know, the skin and the fat and the fascia are going to mix in with the external oblique. So this is a remnant of the external oblique right in here. So the external oblique is going to pretty much cover all this area right in here, and it come off with the skin. So this is your external oblique right here, right there. External oblique right there. Now, internal oblique is all this stuff that you see right here. Internal oblique. Now, let me reflect this back here, and you'll see the transversalis or transverse abdominis. So let me go through that again. So what is this? This is your external oblique. Internal oblique is all this stuff right here. And then you can see the transversalis right there. So hopefully that makes sense. Now, the rectus abdominis, or the six-pack muscle. Let me go over this cat here so you can see. Let me go over to this one. It's probably better here. Yes, much better. If it will stay there. Okay. So, right here, we can see the six-pack right here, or your rectus abdominis. Now, see this line right here? That's your linea alba right here. Linea alba. Okay. Want to next talk about the sartorius muscle and the gracilis muscle. Sartorius muscle is going to be this muscle right here. So here's your sartorius. Here's the gracilis muscle right here. So the sartorius muscle on the cat is going to cover your quadriceps muscles, and I'll show you that in a few minutes. So here's the sartorius muscle. Here's the gracilis muscle right here. The gracilis muscle is going to cover the hamstring group. So this is the semitendinosus, semimembranosus, and the abductors right here. semitendinosus, semimembranosus, and then the abductors right in here. So, sartorius and gracilis is right here, covering the hamstring group, you know, your semitendinosus and semimembranosus, and then the abductors right in there. So semitendinosus, semimembranosus, and then adductors. And pectineus muscle would be right in here. Here's your femoral artery and vein, and I don't think we can see the nerve on this one too good, but I'll show you that again. Okay, I want to next talk about the tensor fasciae latae. So here's your tensor fasciae latae right here, and then right in here would be your gluteal muscles. Okay. So let me show you this on this cat here. So again, we can see, let me move this cat around and show you. So here we have the sartorius, gracilis, and then your semitendinosus, semimembranosus, and then the adductors and pectineus will be right in there. So sartorius, gracilis, semitendinosus, semimembranosus, adductors. Okay. We have over here in pretty good view tensor fasciae latae, and then right in here we have the gluteal muscles. So tensor fasciae latae, and then we have the gluteal muscles right in here. This big muscle here is another hamstring muscle. That's called the biceps femoris. Biceps femoris is right here. Okay. Want to next move on and talk about oh, forgot one. So let me go over this one more time here. So we have the biceps femoris again, right there. We have a muscle that's cat specific called the caudal femoralis right here. So this is the caudal femoralis right here. Right here we have the gluteal muscles, tensor fasciae latae. Let me show you that over here as well. So we can see the biceps femoris here, caudal femoralis right here, tensor fasciae latae, and then your gluteal muscles. Okay. Want to next continue with the lower leg muscles. These are really straightforward. So the first one that we're going to do is the tibialis anterior. Is right here. Right here. Tibialis anterior. Next one we see there we go. So this one right here is your tibialis anterior. This one. Okay? This one right here, right next to it, is the extensor digitorum longus. Extensor digitorum longus on the lateral side. Now, we have this one right here. This is your fibularis longus. This is the fibularis longus right here, or peroneus longus. This one right here is the gastrocnemius, and I forgot one, and it's the soleus. So here's your soleus right here. So just go through these again. We can see the tibialis anterior right here. Right there. And then what's next? we have the extensor digitorum longus. We have what's next. This is the peroneus longus or fibularis longus. What's next? We can see the soleus and then gastrocnemius. This right here is the calcaneal tendon or Achilles tendon. And then right here, let me just show you on this side. That'd be better. On the medial side of your tibia, we see the flexor digitorum longus. And this right here is the gastrocnemius muscle. And that would be the soleus right there. Right there. So gastrocnemius, soleus, and calcaneal tendon. Flexor digitorum longus. And then we can see the tibialis anterior, which is again right there. And I sort of made a mislick right there. So there's your tibialis anterior. The extensor digitorum longus. And then your fibularis longus, soleus, and gastrocnemius. So I think the light was messing up just then. So gastrocnemius, soleus, fibularis longus, or peroneus longus, extensor digitorum longus, and tibialis anterior. Okay. Move to the next. Talk about some more muscles. Let's do the serratus ventralis muscle. So we can see the serratus ventralis muscles right here. If you look right here, we can see the serratus ventralis muscles right there. Okay. Next, we have the intercostal muscles, which can be seen really good right through here. So we see the ribs right here. There's one rib, there's another rib. In between the ribs we have the intercostals. Okay, I want to move on to the transverse costrum. So here's your transverse costrum. Right here, transverse costrum right there. Scalenus medius is right here. And then your serratus ventralis right here. Okay. Let's move on to the next thing here. I want to show you some more structures, more muscles, excuse me. Pardon what I said. More muscles, more skeletal muscles. So, let me prop this cat up here. And we're going to look at some muscles underneath the trapezius muscles. So, right here, we can pretty much see the supraspinatus. And then you can see the infraspinatus again. Right there, supraspinatus, infraspinatus, and then your subscapularis is right in there. Now, I want to show you the rhomboideus muscles. So, you can see the rhomboideus muscles basically underneath your acromial trapezius and spinal trapezius. So, right here we have the rhomboideus muscles. Here we have a muscle called the rhomboideus capitis. Rhomboideus capitis. Remember, we have the rhomboideus capitis right here. And then we have the splenius muscle, which is right there. So rhomboideus capitis right here, and the splenius muscle right there. Okay, we'll move on to the quadriceps muscles. If I can get to them. So let me move this cat this way. So we have 4 quadriceps muscles I want to show you, and I want to show you these, and right here we have the sartorius muscle right here that has been removed, as we see here. Now we have the quadriceps muscles that are exposed. So right here we can see the prime mover, which would be the rectus femoris or your quadriceps femoris. So your quadriceps femoris or rectus femoris. This one right here would be the vastus lateralis right here. Vastus lateralis. And then this one right here would be the vastus medialis. And then underneath your quadriceps femoris or rectus femoris, we have the vastus intermedius right in here. Okay. We have the abductors. I've already showed you those. So let me show you this again. We have the abductors right in here. Didn't turn out that good on this cat. Remember, we have the semitendinosus, semimembranosus, the abductors. Pectineus would be right in here. And then I want to show you the iliopsoas. So I had to cut through some stuff here up into the abdomen area to show you the iliopsoas muscle. And then right in here, maybe it's on another cat. Yes, on this cat right here, you can see the iliopsoas again, right there, and you can see the femoral nerve right there where the probe is, femoral artery, and vein right there. Spells vein, going from medial to lateral. Okay, let's see if there's anything else here. I want to talk about the clavodeltoid muscle, or the clavobrachialis. So this muscle, if you look right here, you can pretty much see that you have your clavotrapezius here, and you can feel in there and feel the, yeah, right there is your clavicle bone. And then once you get past that, it turns into the clavodeltoid or the clavobrachialis. Clavodeltoid or clavobrachialis. Okay, I want to show you the next thing here, which would be the triceps muscles. So here you see the triceps muscles. This is the triceps brachii long head, lateral head, and underneath, which I haven't cut, would be the medial head. So let me flip it over and show you over here. So right here we see the triceps brachii long head, lateral head, and medial head will be right here. I want to next show you the brachialis muscle, and that's right here. Here's your brachialis muscle, and then right here we can see the my probe. We can see right here this muscle right here mixed in with the radial nerve would be the brachioradialis muscle. Is right here. And we have the biceps brachii right here. And an epitrochleus muscle, we can see that right here. So here's your biceps brachii, and then your epitrochleus is right there. And that's it.